September is Atrial Fibrillation Awareness Month. Atrial fibrillation, or AFib as it is commonly called, is a condition that causes a person to have an irregular heartbeat.
It can have some serious complications, including strokes or even death, but many who have this condition don't even know it. So how can you find out if it's something that you're dealing with? Bridget Ellison is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
One of the things that can be concerning about AFib, it can happen to virtually anyone. Dr. Sunil Kumar, a cardiac electrophysiologist with HCA Florida Healthcare, is here this morning to tell us more about AFib. So, doctor, what exactly is it? We know it's a rapid or regular heartbeat. How does someone find out about it initially, usually?
So think about atrial fibrillation is most common arrhythmia in the heart. When you have atrial fibrillation, all that means your top chamber, which is the atrium, is quivering. So instead of beating normally between 60 to 120 beats a minute, your top chamber is now beating between 300, 600, it's quivering of the heart. That can lead to a lot of potential dangers. You know, the most common or the most devastating danger can be signs of blood clot and stroke, because when your heart is quivering, it starts squeezing the blood. And that leads to the pooling of the blood in the top chamber, and that can potentially lead to blood clot and the stroke. So that's one aspect. The second aspect, when you look at the atrial fibrillation, is because your top chamber is beating so rapidly and the top and bottom chamber are electrically connected, just like your house. You know, the two houses are connected electrically. So when the top chamber is beating so rapidly, the bottom chamber, as a consequence, tries to catch up and can lead to the fast heartbeat. Those fast heartbeat can cause either symptoms of palpitation. The commonest symptom that most people with atrial fibrillation experience are they're tired, they're fatigued, they don't have the same energy they used to have. And a lot of time people attribute that they're getting old. And then the only way they realize they felt much better when you get them back to normal rhythm, they realize what difference it made in atrial fibrillation, and their quality of life was so much different.
What leads up to this? Like, what contributes to developing AFib?
So the atrial fibrillation, unfortunately, is a problem of growing age, or as we all say, we mature in the life. Similarly, the atrial fibrillation comes with getting older. There are several other factors that can contribute to atrial fibrillation. If you're overweight or if you have a sleep apnea that are not being treated, that leads to at least 10 to 15 times of having atrial fibrillation over the person who does not have sleep apnea. If you have high blood pressure, if you have diabetes, if you have heart disease or weak heart, certainly people from the European descent, that tends to have a much higher prevalence of atrial fibrillation.
So is there some sort of genetic link to your chances of developing it?
The specific genetic predisposition to atrial fibrillation are not as common. They're more polygenic, which means there are multiple factors involved that led to atrial fibrillation development. And
so how do we get out of AFib? You know, once you've identified it and figured out your risks, what's the course of treatment to get back on track and get healthy?
So when we look at atrial fibrillation specifically, there are three things we'll look at. The number one goal is how do you prevent or reduce your risk of having blood clot? That's number one. The second goal is how do we make sure when you have atrial fibrillation you're not going rapid in the pulse rate? So that's number two goal. The number three goal is how do we get you back in normal rhythm? So let's talk about one each a time. So to prevent you from having blood clot or stroke, there are two strategies that they employ. The number one strategy is the blood thinner. Depending on whether your risk of stroke is low, medium, or high, if your score is medium and high, then obviously we recommend that you take therapeutic blood thinner for preferably lifelong. If you cannot be on blood thinner because your risk of bleeding is high, you have a profession that doesn't allow you to be on blood thinner. So like if you're a pilot or if you do a lot of mechanical job that predispose you to the trauma or the bleeding. In those cases, there are alternatives which are called, essentially it's a filter in the heart that we put it that prevents the blood clot from gaining to anywhere else. Those are called either Watchman or Amulet, which is catheter-based procedure.
Okay, Dr. Kumar, we have time for one more question. What should people do to follow up with their doctors and their, regular care visits to make sure that they're identifying their risk for that?
So being aware of that the atrial fibrillation is very common, looking for the signs and symptom atrial fibrillation. If you're unusually tired, fatigued, or you're not yourself and you've noticed your pulse rate is high. A lot of the people carry smartwatch, which does give them an indirect, or a lot of times they can be accurate, especially in the older population. Then if they see their watch alerting them to irregular heartbeat or atrial fibrillation, they should seek help from the physician and hopefully get diagnosed sooner.
All right, great information. Thank you for joining us this morning.
Absolutely, it was a truly pleasure.
Yes.